I never came back like I used to, that's for sure.
People like Jean Bonneau, COVID-19 long haulers with symptoms weeks or even months after infection may wind up here at the Montreal Clinical Research Institute that just opened up the city's first COVID-19 long hauler clinic to treat patients and conduct research.
When I saw the types of presentations people were having in the acute phase of the COVID infection with this intense cytokine storm, I wondered if there would be long-term sequelae of this intense inflammation. And that's where the idea really was developed.
I couldn't eat, couldn't drink, I was hospitalized and on morphine for 5 days with dosage from, they told me it was a dosage they were giving to people dying from cancer, so in terminal phases. And that lasted for 2 weeks. And after that, it took a long time before I could even take a walk for 5-10 minutes or go upstairs or things like that. That took a few months.
Jean caught COVID-19 while working just a few days in a nursing home last year on April 30th.
Still, as today, I taste maybe 50% of the food I ingest, and I can't smell. I would say it's the same thing. It's about 50% of smell. And I stayed with anxiety since then.
The post-COVID clinic, designed for people like Jean, has been taking appointments since last week. Similar clinics are already set up in Toronto and Vancouver. Dr. Falcone says people with prolonged symptoms of COVID-19 ranges from 20 to 70% of positive cases experiencing at least one long-haul symptom.
We're finally able to open this clinic. And of course, the prediction was right. We really see that there's a need in the population. And I'm just getting so many calls from patients, hearing all these different stories, all saying like, yes, there's a need.
I think it's a great idea. We'll feel a little bit more supported.
The IRCM clinic can receive up to 570 patients, but you have to meet the criteria and call to see if you're eligible. You need to be 18 years old and up, have a positive COVID-19 diagnosis, and be 28 days or up to a year post-infection. Once eligible, you'll be screened here, and lab tests will be conducted to delve into your symptoms.
We're looking to figure out what's there. So what are the complications? What are the complications in our Quebecois population? How long do they last? And then we're trying to understand, what's causing these complications?
Possibly benefiting Jean and others in his shoes.
I think it's important to go there and, if it could help others in the future, why not?
In Montreal, Alyssia Rubertucci, City News.